The Attorneys TV show, breaking down current events, no holds barred. The only show with no topic of limits, where all viewpoints are welcome and you live chat during the show. With our guest in the state of Michigan, Dr. Sarah Mcdade, MD, Executive Director of the Well Health Initiative, over 20 years of practice in Detroit, and Medical Director at an esteemed hospital in Detroit. And tonight's hot topic, cancel culture and Dave Chappelle. Was Dave Chappelle wrong for his comments on LGBTQ and Black America? Should Netflix give in to LGBTQ demands and fire Dave Chappelle? We want to hear from you. All viewpoints welcome to give your comments and live chat during tonight's show. With your host from the West Coast, Attorney and Minister Vicky C. Jackson, from the law office of Vicky C. Jackson in Tacoma, Washington. With your host from the Central Region, Attorney and Minister Urena Ricks Johnston from Ricks and Associates in West Bloomfield, Michigan. And with your host from the East Coast, Attorney, Minister, and Registered Nurse Rossi Williams from Rossi Williams Law Group in Miami, Florida. So save the date and don't miss it. Watch and follow The Attorneys TV show, streaming every Thursday at 7:30 p.m. Eastern Standard Time on YouTube and Facebook. And to get a text reminder when the show goes live by texting the word The Attorneys TV show to phone number 33222. And now let's join the attorneys.
Hello and welcome to the Attorneys TV show. I'm your host for today, Attorney Urena Ricks Johnson, and we have a great show for you again this week. I'm going to introduce my co-host, Attorney Rossi Williams. Attorney Williams, how are you tonight?
I am well, Attorney Urena. Welcome to our guest and welcome America. We have an exciting show for you this evening.
We do have another attorney co-host, Attorney Vicky Curry Jackson. We are yet still in prayer for her in the loss of her husband. We hope to welcome her back very soon. We love you, Vicky, and we are yet praying for you. We also today have another guest. We have Dr. Sarah Mcdade, who's here today. Dr. Sarah, how are you today?
I'm doing great. Thank you.
We're going to give you a little bit more about her credentials and who she is as we get into our topic on tonight. But we thank you, Dr. Sarah Mcdade, for being a part of our show. I'm trying to give you another profession, huh?
That's all right. Thank you.
Yes, we have another great and exciting show. We want to make sure that you still stream with us every Thursday at 7:30 p.m. Also follow us on the Attorneys TV show on YouTube and Facebook. And also we have a new feature now where you can text and get a text reminder of our show. And you text the one word, the Attorneys TV show, to 33222. Again, text the Attorneys TV show to 33222. Today, we're going to talk about healthcare disparities. We have the upcoming election, and we are talking about healthcare disparities because we feel that this should be a topic in the upcoming election in November. We have a lot of topics that's before everyone, but healthcare is a major topic, and we're going to discuss that tonight. And we're also going to discuss cancel culture. Should someone be canceled because they disagree with someone's lifestyle? We're going to end with talking about that hot topic. But before we get into that, we're going to discuss no holds barred, healthcare, and healthcare disparities. The first thing we're going to discuss is healthcare a fundamental right that should be guaranteed to all Americans? Attorney Rossi Williams, what do you think about that statement?
I believe when we first talk about this, we need to delineate for everyone what we mean by a fundamental right. When we discuss a fundamental right, we are discussing an enumerated right, a constitutionally protected right. So it means that it's something guaranteed in the Constitution. We're familiar with enumerated rights, for example, such as freedom of the press, freedom of religion, freedom of assembly, freedom of association. When we're then talking about healthcare as a fundamental right, we have to see if it falls under that umbrella. And of course, it does not. But to your question of should it be a fundamental right, I believe that it should. We've seen federal courts take the issue of public education in elementary schools, middle schools, and high schools, and essentially make free public health care a fundamental right, meaning a protected or guaranteed right, although that right is not enumerated in the Constitution. So there's precedence to do that. And I do believe that every American should have that protected, guarantee, and enforceable right to health care. And I believe we have compelling reason to do so.
And Attorney Williams, you brought up some great points, and breaking down only on the Attorneys TV show where you get this broken down, fundamental rights guaranteed under the Constitution, and then the going beyond that. And there is precedence to allow that. So I tend to agree with you that it should be a fundamental right. And I think that we need to take a careful look at our healthcare system in America and examine that. Well, speaking of healthcare, we have a healthcare professional with us today. We have Dr. Sarah Mcdade. She is a doctor here in the state of Michigan, in my home state. And she's also a prominent doctor at a hospital in the Detroit area, as well as owner and operator of The Well, which is a nonprofit organization that she runs as well. Dr. Mcdade, we thank you for joining us on today. We're going to discuss with you healthcare disparities. Can you tell us about what are healthcare disparities?
Of course, and thank you for having me. I'm really excited about this, and this is definitely my passion. The Well Health Initiative is all about health advocacy, and there most definitely are health care disparities in the United States and worldwide, but we're going to talk about our home country. And in terms of disparities, for healthcare disparities, it is a preventable difference. And that's the key word, it's preventable. These disparities are differences between groups that have advantages and groups that are disadvantaged on social levels, economic levels. These disparities can be based on gender, sexual identity, race, age, where you live in geography, rural versus urban. So they can be very widespread and have a huge impact.
Wow. And then, we sometimes think about disparities just in the issue of color, but you brought out some other disparities. Where have you seen those disparities in your practice and your as far as with urban and the other areas of healthcare disparities? Can you describe those a little bit more for us?
Definitely. I've worked in several settings. I've worked in a hospital setting as an employed doctor. I've been in private practice with my own clinic, as well as in a hospital outpatient setting in the state right now. And I have seen disparities happen across the board. So in my private practice, I was dealing with patients who were involved in auto accidents. So we ended up with cognitive injuries and mental illness. And there is great disparity for the medical illness area. Poor insurance coverage, poor understanding, they're often avoided, dismissed. We see it, and it's really become prominent and exposed for the Black community and people of color, that just historically there has been a lack of access, quality care, even consent for care in the Black community. And so that's a large part of what I've been seeing and a large part of why I started the Well Health Initiative. But I also see it in other realms. We see it for our older population, in that some of the research done was based on younger people, younger cohorts in the research, and then it's placed onto older groups. And we've seen that also when it comes to race. A lot of the information that we've used over the years for medical practice that is taught in the medical schools were based on research done on smaller populations or white populations or male populations. And then that information is extrapolated over to women or over to people of color. And so we see that when you have a foundation based on a lack of representation, it ends up being propagated and exponentially increased in terms of the consequences and damage that can happen when you have inaccurate information from the beginning.
Wow, that is great information. Thank you, Dr. Sarah Mcdade. That was some great information. We're going to go a little bit further and talk more about healthcare disparities. Let's watch some footage on disparities.
Lauren Hoonsley wasn't always this active. For years, she suffered severe knee pain. On a scale of 1 to 10, my pain level was an 8 to 9 every day. But 3 doctors told her the same thing. I was too young to have the surgery. Surgeon Mary O'Connor says doctors often treat women like Lauren differently than men.
The term that I like to use is I'm not sure that a woman's voice is always heard as clearly.
One Canadian study found physicians who evaluated patients with moderate knee arthritis were 22 times more likely to recommend surgery for males. In another, women were up to 23% less likely to receive opioid pain meds in the ER.
Does the doctor think that her pain is as bad as the woman says it is?
Studies also show minorities are underrepresented in clinical trials. African Americans only account for 5% of participants, and Hispanics make up 1%.
Sometimes we're just uneducated on what's available.
Yes, as we can see, this is a real issue and problem in America. But we're going to go and talk about some solutions. We also have Attorney Rossi Williams, who is not only an attorney, but she's also a registered nurse. So we're going to ask her, we're going to go into a little bit deeper. What can we do to overcome some of these disparities, Attorney Williams?
I would say the first thing is to recognize, identify, and deal with our own biases. You know, we have such an esteemed guest here as Dr. Sarah Mcdade, MD, tonight. But usually when you enter any type of healthcare setting, before the patient ever makes it to someone like Dr. Mcdade, their first encounters are either with the nurses who work in that practice or that hospital, or some type of medical assistant, which means that the triage and the gathering of information, which is going to flow to the physician, starts at that moment. So if the healthcare providers would take the time to deal with their own biases when they're collecting the information, when they're asking the questions, that would go a very long way in opening the door to equal access to healthcare and to optimal healthcare for all. Because the way that we ask the questions, our biases, which give us some type of slant sometimes in how we ask and what we believe about the patient whom we are triaging, and how we summarize and write down or document the interaction and the parameters of that visit to then send that information to the physician makes a big difference. For example, if I think that when Black people come in to be treated, that Black people have a high pain tolerance, or all Black people coming in seeking some type of pain relief have an addiction or are drug users, that will definitely have a bearing on what I document as that first person in the flow of care. And then that information is what I would pass on to Dr. Sarah Mcdade, who's coming in to see that patient. So deal with our own biases first. And then secondly, and finally, listen to the patient and take the patient at his or her word, unless our clinical observation and expertise or the signs and symptoms prove otherwise. Don't let it be because of our bias that someone is not treated appropriately.
Yes, this is a major issue and great information for someone that is facing, having to find a doctor or facing just a health scare, and we know that, going to the doctor sometimes for some people is a very traumatic experience. And we are here today to give some information to help you with that experience. I'm going to ask you the same question, Dr. McDade. What can we do in order to overcome these disparities?
Well, first of all, that was an excellent answer by a obviously skilled nurse. And I totally agree with that, in that unconscious bias plays a huge role in causing a lot of difficulties, a lot of disparities, a lot of problems in healthcare. And there have been studies that have recently showed that it definitely proves beneficial to have a doctor or care provider that looks like you. And so I think that's an important aspect as well, that they have found that they're more engaged. You're able to get consents for vaccines and for research studies and for preventative care and screenings when you're engaged with someone who looks like you. There's more detailed notes, more engaging and talkative communication between patient and doctor. Does that mean you have to have a doctor that looks like you? Not necessarily, but you have to understand that when you don't have someone who's necessarily looks like you or can relate to you on several levels, that we have a likely chance of running into our disparities and the unconscious bias. I do think also when you look at the population, we have 14% of Black Americans in the United States, and there's only 5% of Black physicians out of the whole physician force. So we are already at a loss that it's hard to find somebody who looks like you. But when we start looking at nurses, physician assistants, nurse practitioners, midwives, doulas, we can increase the contact of people of color, treating people of color when we start working in a team manner and start bringing in all those perspectives. And I think that's important. I think information is another huge thing. We have to be informed, and we have to be able to give that information in a clear and concise way to patients. And so many times the appointment's rushed, and the patient is intimidated, or they've waited forever and only have 5 minutes with the doctor. And oftentimes they don't even know what to ask. So it helps to have someone who can help guide you, or resources in that way that you can go to that can help prepare you for those visits. Going in with as much information about your condition really helps you at least ferret out if the doctor is really hearing you, or if what they say, at least on the superficial level, sounds right. So information is another issue to address the disparities. And then, it goes even beyond. If we look globally, we've got bigger issues, environmental, societal.
Yes,
it's a complex issue.
That's definitely some great solutions. And I just want to share my personal, I knew that there was disparities when I was pregnant with my son, and I have a doctor that looks like me that is an OBGYN. And I wanted to go to a particular hospital that was in the suburban area. She was at 2 hospitals. And she distinctively told me that she needed to call the hospital, let them know that I was her patient, because they would treat me a certain type of way if I just came off of the street. And I just really, and it just caught me off guard, because I just thought that I would be treated differently if she had not called. But I could tell the difference even when I came in. They were just like, "Oh, your Dr. So-and-so's patient. Oh, she wants a report on how far along you are. We got to call her." But I knew that she had made that call, but imagine me going in, I'm a first time mom going in the hospital, trying to figure this out. And I just thought about so many women that did not have that, going in and having their child. And I just thought about, and that's what I was really, more conscious of, these disparities that happen and every day that we don't even think about.
Absolutely.
But we are talking today also about, the upcoming election. We hear all these politicians on the TV that are talking about elect us to, this office and things of that nature. But today we're going to talk about, should individuals' stance on healthcare play a role in how you vote this coming November? Attorney Williams, what do you say about that issue?
Unequivocally, yes. Healthcare has to be on the ballot. I don't know how many elections we've gone through still debating this same issue. If a person can't eat, if a person can't drink, and if a person can't take care of themselves, those are really the top three priorities. Even if you're going through Maslow's hierarchy of needs that we learned in health, in nursing school, your self-preservation, the basic ability to be able to take care of your basic needs, which includes your health, those are priorities. It should definitely be on the ballot.
Dr. Sarah Mcdade, what do you say? Do you think that healthcare should be on the ballot this coming November?
Absolutely. It is a must. And I think at this point, with so much misinformation, I think that people don't even realize exactly how important their healthcare is. I mean, we see in years past where people didn't want Obamacare, but they wanted Affordable Care Act. There was so much misinformation that it was the exact same thing.
Wow.
But because of political spin and they miss the point that they're losing something that allows them health, quality of life, and it not only impacts them, it's the next generation. What we do for ourselves, we often push on our kids. So if we don't feel that healthcare is important, if we're not seeing going to the doctor or taking care of ourselves, our kids see that and pick that up. So it's not just about us. We have to be able to fight for what's for our future generations as well.
Yes, that's so important. And I'm going to give my answer, and I say yes, healthcare on the ballot 2021, definitely. Another issue that plays into healthcare is health insurance. And we're going to watch some footage on health insurance.
Access to healthcare is especially important during a global pandemic. In the United States, most people need to pay and do so through health insurance. Around 30 million people are uninsured, and another 40 million people have health plans but are underinsured, meaning they may have significant out-of-pocket costs if they get sick. Health research group the Commonwealth Fund recently ranked the United States last out of 11 high-income countries when assessing access to care, administrative efficiency, and equity.
I think COVID has really just unveiled the significant challenges in our healthcare system. When we look at Black and Latinx adults in the U.S. Who've historically had much higher uninsured rates than white adults, for example, we also see the same similar inequities in terms of COVID diagnoses and COVID deaths.
Yes, we definitely see those disparities. Dr. Mcdade, can you tell us what role do you feel that healthcare played in this global pandemic that we're in right now?
That actually makes me laugh because it's all about health. It's all about healthcare because it's a pandemic. It's a medical issue. And I think that just got totally lost in all the political shuffling, both here in our country and worldwide. It's all about the healthcare. And I think some things went well. I think the healthcare community mobilized. That front line was in there, getting dirty, right? Dying, getting sick, but they mobilized. And the scientific community, they got to it as well. There was a lot of research behind what's happening and the nature of this virus. And then even the pharmaceutical company, despite how profitable it is, we still needed treatments and medications and vaccines. And so I think there were a lot of good things that the healthcare community did for this health issue of the pandemic, but there were also some things that didn't go well. And I think that, the cat was let out of the bag in terms of the disparities. It cannot be denied that Black people, people of color, poor people, terrible health. We don't get the same care. And I think, again, that this pandemic potentially would have been approached differently at times had other populations been impacted more than the Black community. But I think definitely it's all about healthcare. We know politics come into play and we need rules and legislation and all that. But at the bottom line, it is a healthcare issue. And I think that the more we attack that in its pure form, and get that settled, then we can deal with the politics and the legislation and all that.
I definitely agree. And I think our running theme for this segment is healthcare should be on the ballot this upcoming November election. Healthcare is important. It should be at the forefront of our minds, and healthcare and having that healthcare system that works and eliminating these disparities. We thank you, Dr. Sarah Mcdade, for being a part of the Attorneys TV show today. How can our viewers reach out to you?
Oh, definitely. Well, they can reach me at my website. It's thewellhealthinitiative.org or thewellhi.org, whichever is easier. We're also on social media as the Well Health Initiative, both on Instagram and Facebook.
And if you are in the Michigan area and you need assistance, we have Dr. Sarah Mcdade. She's here. Her organization is here to provide that healthcare or even provide resources. She's here to provide that. And we thank you so much for being a part of the Attorneys TV show today. And thank you for sharing your knowledge, your wisdom, for just providing informative information for our viewers. We thank you again.
Can I just say thank you? I appreciate so much what you guys are doing, and Black Girl Goals, get it done. I love it. Thank you so much.
Yes, and now we're going to discuss a hot topic. I know that we've seen in the news the current cancellation of David Chappelle. He's faced some scrutiny based on some things he said in his stand-up routine. And we're going to watch some footage of that stand-up routine.
And they've canceled people that are more powerful than me. They canceled J.K. Rowling. My God, J.K. Rowling wrote all the Harry Potter books by herself. She sold so many books, the Bible worries about her. And they canceled her because she said in an interview, and this is not exactly what she said, but effectually, she said that gender was a fact. And then the trans community got.
Now, does the cancellation of David Chappelle prove that there is some racism within the LGBTQ community? Attorney Rossi, what do you say?
In general, I would have said no, but because you specifically pointed this out, I would have to agree when we go back to the context of how we got to this point with Dave Chappelle. There is a white man who identifies as a woman, so he's called transgender, and he's actually the showrunner of the show Dear White People on Netflix. He was the person who spearheaded, or society would say she was the person who spearheaded this movement or backlash, if you will, against Dave Chappelle, based on Dave Chappelle making jokes about transgender people, as you stated in one of his routines. This in and of itself was really such a blatant hypocrisy to me that I couldn't wrap my mind around it. How do you have, first, a white person writing and producing or running a show called Dear White People, which if you've ever seen it, it is a Black issue show, supposedly from a Black perspective of the issues and the ills that Black people face in society. So it wasn't even until this person tried to stir the backlash to Dave Chappelle on social media that many people even learned that there was not a Black person running or given the perspective of Black people on Dear White People. And so this person felt, as a white person, as a trans person, I should have the power to cancel or lead the cancellation of a Black man who's making jokes and stating issues not only in relation to transgender people, but even Black people. But within that privilege that I have, this is the mindset of how I saw the person's mindset. I can disregard all of that and ask America and Netflix to cancel this person, a comedian, for making jokes about transgenders. It's okay for him to make jokes about Blacks, whites, fat people, skinny people, poor people, rich people, educated people, uneducated people. and there's no issue. But as soon as he makes a joke about someone who's transgender, he needs to be canceled. No, he should not have been canceled. And yes, and he wasn't, because Netflix refused to cancel his show. And yes, I do see those vestiges of racism there in the LGBTQ community, who for some reason, or which for some reason has deemed itself untouchable.
I agree. I think that their money, their influence has gone a long way, and it has showed really the racism that is underlining even within that community on what can be said, what cannot be said. You know, like you've stated, there are jokes were made across the board, but those were singled out and those were inappropriate and those required for him to be canceled. I think this is just another evidence of racism and the underlying agenda, even within the LGBTQ white community. Also, Dave Chappelle made some statements, basically talking about the way that he gave his jokes and talked about the LGBT community. He made statements to say that there is a lie that is being stated that if you disagree with someone's lifestyle, that you fear or hate them. Also, he talked about whether when you say you love someone, you have to agree with everything they say. What do you think about that statement? Those statements, Attorney Rossi Williams?
I think he hit the nail on the head. For example, what we've termed anyone's disagreement nowadays is some type of suffix. It's either ist, ist, ism, ism, or phobia, homophobia, transphobia. So if I don't agree with your lifestyle, then I have a fear, because that's what a phobia is. It is a fear. Or if you say something to me as a female that maybe I don't like, automatically you are a sexist, ist. And so we've gotten to that point where people can no longer respectfully disagree, nor even really have the discourse to determine whether or not what the person said was really an ist, ism, or phobia. It's just immediately you said something and there were some buzzwords in it, and that automatically makes you someone who doesn't like me or hates me. That is an issue there, because as a society, all of us, and when I say all of us, I mean, I don't care what your race is or your gender is or any of those things. All of us as adults, we should have the intellect and the intelligence to be able to have a conversation, to be able to drill down to the nitty gritty, if you will, to be able to go in and to count up the cost of a matter, be able to hear what the person is saying, and try to hear it enough to determine what is the context and what is the intent, versus automatically saying, I'm going to cancel you for everything. The other issue I have with this is that it's very arbitrary. Mm-hmm. It really depends on who the person is that made the offensive comment as to whether or not that person is canceled. I think we just saw a situation where one of the coaches in the NFL has now been suspended for messages or texts that he wrote or emails over 10 years ago, I think about 15 or 20 years ago. And those texts, they said offensive things about Black people, and here he coaches Black people. And so you look at that and people are saying, yes, he should be fired and should have been fired, because those are racist messages. But then we will look at someone who maybe said something 20 years ago. And, one of the senators, Strom Thurmond, who of course is no longer here, would be a great example. Someone who was a huge segregationist. And then we get to a point of, well, later in life, they've changed. So the arbitrary nature of this bothers me as well. How do you determine what length of time is long enough to say someone changed? And if they apologize, why do you accept the apologies of one, but not the other? Those things alone make me find this kind of stuff really, really absurd a lot of times. Be consistent. If a text or a message from 30 years ago regarding race should cause this person to be negatively impacted, Make that the rule for everyone.
Across the board. I agree. And I agree. And I think that it's a sad thing within our society when we can't respectfully disagree with each other. You know, where we can't have a conversation, and just because I don't agree with what you're stating, that it's automatically that I'm canceled, and you don't want to talk anymore, and that I am deemed a certain way. And that's just unacceptable. It should never get to that point where we can't respectfully agree to disagree. We are licensed ministers within the church, and there are stance that we have concerning our convictions and our belief. And we also understand that we love everyone, but we have certain convictions and certain things that we live by, a code that we live by, that we're not going to apologize for. We're not going to state that's wrong. We're not going to call something right when it's wrong. We're not going to call it like that. So those are things that we have to make sure that we understand, and make sure that America understands that we need to get to the point where we can respectfully agree to disagree. And we are going to, at this time, offer prayer, because we know that our world and our nation needs the Lord. And we're going to offer prayer at this time. God, we thank you for your goodness. We thank you for your mercy. We thank you for your loving kindness. God, we know that some people are hurting. They're experiencing loss. They're experiencing grief. They're experiencing these healthcare disparities that we've talked about. They may be even experiencing things that they have been so-called canceled within our culture before, based on their beliefs and their convictions. And we ask that you provide comfort, strength, your anointing, and your power to let them know that you're there with them, God. We thank you for all things. We thank you for being with us. We thank you for your tangible presence even now. And God, we give you glory, honor, and praise today and always. In Jesus' name we pray. Amen.
Amen.
Amen. Thank you so much again for joining us this week for this exciting topic. On next week, we're going to have another exciting show with Attorney Rossi Williams being our host. And we're going to discuss another hot topic. We're going to discuss no holds barred, another issue that we know that you're facing here in America. And we welcome you again to make sure you follow us on the Attorneys TV show on Facebook and YouTube. We ask that you stream with us. You join us on streaming every Thursday. We're here every Thursday at 7:30 p.m. We're here, and we're here to service you, and we're here to go over these top topics with you. We thank you again for joining us. Make sure you follow us. Make sure you watch us every Thursday. We're here, and we want you to be a part of our show. Thank you for joining us today.
Night.
Good night.
Yes! You just watched another exciting broadcast of the Attorneys TV show, breaking down current events, no holds barred, with guests from across the nation. Streaming every Thursday at 7:30 p.m. Eastern Standard Time on YouTube and Facebook. Follow the Attorneys TV show channel now so you won't miss one show. And sign up to get a text reminder when the show goes live by texting the word The Attorneys TV Show to phone number 33222. With your host from the West Coast, Attorney and Minister Vicky C. Jackson, from the law office of Vicky C. Jackson in Tacoma, Washington. With your host from the Central Region, Attorney and Minister Urena Ricks Johnson from Ricks & Associates in West Bloomfield, Michigan. And with your host from the East Coast, Attorney, Minister, and Registered Nurse Rossi Williams from Rossi Williams Law Group in Miami, Florida. So save the date, watch, and don't miss the Attorneys TV show, streaming every Thursday at 7:30 p.m. Eastern Standard Time on the Attorneys TV show channel on YouTube and Facebook. And sign up to get a text reminder when the show goes live by texting the word The Attorneys TV Show to phone number 33222. See you next Thursday. Don't